about the chicken soup. Does chicken soup make you feel better? Is that going to keep you healthy?
That is a good one. All right, feed a cold, starve a fever, don't go outside with wet hair. What's the truth and what's the myths when it comes to preventing and treating colds or the flu? Infectious disease expert Dr. Tammy Lundstrom is here, and pediatrician Marcus DeGraw, both from St. John Providence Health, are here helping us separate fact from fiction. Welcome to both of you.
Thank you.
You have been typing away in the chat room. Let's blow through some of those chat room questions real quick. First of all, the hiccups, giving a teaspoon of sugar for the hiccups, Dr. DeGraw?
Absolute myth. Yeah, sugar helps, hiccups not at all. And hiccups are common in babies and they don't bother them, so the best treatment is doing nothing.
Well, I wonder where that came from. Speaking of sugar, though, does sugar make kids more hyper?
Absolutely not. Some recent studies clearly show that giving kids sugar doesn't affect their activity level at all.
Really?
Really.
Did you hear that? Giving kids sugar does not affect their activity level. He's got the science, too. Dr. Lundstrom, let's talk about taking zinc, echinacea, all those things to treat a cold or prevent a cold. Any truth behind it?
They actually don't work either to prevent a cold, which is caused by a virus, or to make you feel better faster from a cold. Generally, colds go away in 5 to 10 days on their own, and really it's coincidental that they go away after you start taking these products.
So you can certainly treat the symptoms, right? And you can kind of take a decongestant or something to make yourself feel better.
Right, but they don't help shorten the duration.
Jeez.
Or...
All right. Let's, before we get to a couple of these other flu myths, I want to ask you, the antibacterial rubs, scrubs, and all that, are they good, bad, or otherwise better than soap or not?
They're very, very effective. The alcohol-based hand gels that are available are as effective as soap and water. Very good to use, except if your hands are visibly soiled, you need to use soap and water.
Okay, let's go ahead and tackle this one. You will catch a cold if you are cold or wet. Doctor, what do you tell your new parents about their babies?
Well, getting sick requires that you get exposed to illness. You actually catch the illness from somebody else. The temperature outside, or whether you have wet hair, or what kind of clothes you have on doesn't affect that at all.
It doesn't?
Correct.
Now listen, doctor, because my husband and I go back and forth, he's constantly telling the kids to put on their winter coats. You're going to get sick, you're going to get sick. That's not true, right?
Correct.
So I'm right.
Absolutely.
Really? Okay, so does it make you more vulnerable, though? If your body is struggling to keep warm, does that make your immune system more vulnerable?
Well, there's a more recent study from 2005 that says that it may make it more likely when you have a virus that it will expose itself a little easier, but it was one small study without great data, and other studies say
and Dr. Lundstrom, you say no.
No, really doesn't have any relationship to catching a virus.
Really? All right. You still need to bundle up for other... Do you lose most of the heat out of the top of your head? Is that true?
Another myth. You lose heat from everywhere. You don't lose the vast majority out of your head. You lose it from everywhere.
Oh. All right. Okay. How about I can catch the flu from the flu shot. We're going to blow through that one because Dr. Lundstrom, you already said.
Right. Cannot catch the flu from the flu shot.
All right. Antibiotics. We always talk about there being this overexposure to antibiotics, and that's still the case. But people are wanting to take them to treat the cold and the flu. Do they work?
Not against the cold or flu. Colds go away on their own. There's really nothing we have to treat colds except symptom relief. Flu, we have medicines to treat those. You have to see your doctor within 24 to 48 hours of getting symptoms.
Right.
But they're antivirals, not antibacterials.
All right. Some of the other fun ones that we talked about. Toads and warts, any real connection there?
Actually, no. This is definitely a myth. Warts are caused from a virus, HPV virus, and it's really passed person to person by close skin contact.
Well, as long as we're talking about virus, what do we say about toilet seats? I mean, you know, can you sit on a toilet seat, doctor?
Absolutely. No risk of catching any kind of sexually transmitted diseases from things like toilet seats. Of course, any surface, if anybody sneezes and puts a cold virus there, and you contact that surface and touch your mouth, you're going to possibly catch that kind of illness. But all the things like toilet seats, they're totally safe.
There we go. All right. Toilet seats, totally safe. Good job, doctors. Thank you. And that is the bottom line is wash your hands all the time. Best way to protect yourself. All right, guys. Back to you.